I'm Greg Jamian, and welcome to Home Health Care Corner. As more people receive their medical services and care at home, there are many questions that pop up that sometimes require quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hi, my name's Janet. I'm a registered nurse for Ameristaff Home Nursing. Today I'm going to talk to you about urinary tract infections. The signs and symptoms of a urinary tract infection will vary depending on the person's age. As we age, our immune systems respond differently. Half of all women will develop at least one urinary tract infection in her lifetime. Most urinary tract infections are easy to cure with the use of an antibiotic. But if they're left untreated, the infection can spread into a more serious condition, including a bloodstream infection called sepsis. Elderly people have an increased risk of developing urinary tract infections for a number of reasons. As we age, the muscles in our bladder weaken, so this doesn't allow us to empty our bladder as completely as we used to. Keeping the urine into your bladder increases the risk of bacteria staying into your bladder, causing a urinary tract infection. Other medical conditions can also increase our risk, such as diabetes or an enlarged prostate. These conditions can decrease the urine flow, making the urine stay in the bladder more and increasing our risk for bacteria. Immobility, or not walking around as much, can increase the risk for a bladder infection or a urinary tract infection. As we become immobile, it's harder for us to get to the bathroom as quickly. Sometimes we have incontinence, and that increases our risk for urinary tract infections. Decreased immunities. As we get older, our immune system gets weaker, and so that increases our risk for urinary tract infections. Some typical signs and symptoms of a urinary tract infection for a younger person includes cloudy urine, frequent trips to the bathroom, urgency or not being able to make it to the bathroom on time, pain or pressure in your lower abdomen, a low-grade fever, foul smell. But as we age, these signs and symptoms don't show up in elderly people. The symptoms you need to look for in elderly people is any sudden change in behavior, such as confusion, increased agitation, maybe some poor motor skills. They're tripping more frequently, they're falling more frequently. They're unable to do the tasks that they could do before. All of a sudden they can't do their routine tasks. Dizziness is a sign and symptom of a urinary tract infection. And the number one thing is frequent falls. If your elderly parent is becoming more confused or falling more frequently, don't think that it's part of the old age process. It could be a urinary tract infection. Get it checked out. Here are some ways to reduce the risk of a urinary tract infection. If you're incontinent, make sure that you're changing your undergarments or your brief more frequently. Do not let that urine stay on the skin. Keep your genital area clean. For a woman, make sure you wipe from front to back. We want to set reminders or timers to remember to go to the bathroom. Do not hold your urine. You want to empty that bladder completely, get rid of that urine. We also want you to drink plenty of fluids. You need to drink at least 6 8-ounce glasses of water. A bottle of water is 2 of those servings. So if you drink 3 of these bottles of water, that will equal your 6 8-ounce glasses. We want you to avoid alcohol or caffeine. Alcohol and caffeine will increase your risk of dehydration, and that will increase your risk of a urinary tract infection. Make sure that you're wearing breathable underwear, cotton or briefs that let the air pass through. Those are some tips and signs and symptoms of urinary tract infection. If you have any further questions, please do not hesitate to contact the nursing staff at Amera Staff Nursing at 248-288-2270. Thank you.